Hello viewers, welcome to another video in the video series of Miracles in the Making Davina and Daniela's story. I hope you guys are following up on the story and having a good time. It's all about sharing the miracle hand of God, the powerful hand of God in the life of these beautiful girls. God has been so faithful, and as we share their story, just remember to thank God for their lives and thank God for how far He has brought them. So as you can see, this is Davina. On the side is Daniela. You'll get to see her fully maybe as the video runs through. But that's Davina. She just had a surgery, a heart surgery. Yeah. And that's actually the first heart surgery. Oh, you can see Daniela close by. Daniela, say hello. We can see you, Daniela. Okay, back to Davina. On her thighs, you can see some tubes and a plaster. She just had a heart surgery, and it was done through the thigh. So what happened was she had pattern ductus arteriosus. It's a persistent opening between the pulmonary artery and the aorta, which normally it should close after birth if kids have that, but because Davina was so premature, she didn't get the time for that to close up. Yeah, so it's quite common with premature kids. Yeah. So what they did is they didn't do an open heart surgery. They decided to do a catheter surgery. That's a small surgery where on the thigh, as you can see, the thigh there, a thin flexible tube called a catheter was inserted into the blood vessel. So the catheter is guided to the heart using techniques like fluoroscopy, and that's actually what they use for her, which is an X-ray guidance, and echocardiography, which is an ultrasound of the heart. So they use that to be able to place a device in the hole to close the hole in the heart. So what they did is once the catheter, they send the catheter through her thigh, as you can see on that area in her thigh, they send the catheter, and once it reaches the location where there's a defect, that is where there's the hole in the heart, a specially designed closure device is delivered through the catheter. So the device is expanded to cover the hole. It typically consists of two discs connected by a central waist that fits snugly into the hole. Yeah, so that was what was done to close the hole in the heart. So like I said, it was they could watch how everything was going on using the X-ray. So once the device was delivered, then they brought out the catheter through that from the thigh, as you can see there. And once that was done, then they closed it with a bandage, a tape. So you can see that's the tape that was closed, and that's where that's the catheter still hanging there. Just so you know how the procedure was. So we'll find out in the next video if this was successful, if it helped to close the hole in the heart. But for now, thank you guys for watching. Thank you for joining us. Please always remember to share, encourage someone so they can watch how faithful God is. Thank you.